Good evening, everyone, and thank you very much for joining us for what I think is going to be an extraordinarily interesting meeting with somebody who, in my view, is doing a fantastic job as the Surgeon General of the United States of America. Dr. Vivek Murthy, I used to mispronounce his name, it's Murthy, is the 21st Surgeon General of our country. He has been going around the country talking about a whole lot of issues, eliciting information from families all over America. He is also the author of a best-selling book called Together, The Healing Power of Human Connection in a Sometimes Lonely World, end quote. He lives in Washington, D.C. with his wife, Dr. Alice Chen, and their two children. Dr. Murthy, thanks so much for being with us.
Thank you, Senator Sanders.
The subject we're going to be discussing this evening is something I know that you have been working on, you're familiar with, you've been talking to people all across the country about, and that is the crisis of mental health, and especially how it impacts our young people. Why don't we begin by just talking a little bit about the symptoms. What are we seeing out there right now in terms of mental health?
Well, Senator Sanders, I'm so glad that we're here talking about mental health because I believe that mental health is the defining public health crisis of our time. And I believe that because our mental health really is a fuel that allows us to do everything else in our life. When we struggle with our mental health, it's harder to show up for our families. It's harder to be our best selves at work. It's harder for our kids to perform in school. It's harder for us to participate in society and be a part of our community. So that fuel really matters. And what we are seeing, unfortunately, through stories and statistics, is that mental health is becoming an increasing challenge in our country, particularly for young people. There are a few numbers I like to keep in mind to remind me of how significant this is. One is the number 57. That's a % increase in the suicide rate among young people that we saw in the decade prior to the pandemic. And the pandemic poured fuel on the fire, so to speak, but the fire was already burning, prior to COVID-19 arriving. The other number that I keep in mind is the number 44%. That's a percentage of high school students who feel persistently sad or hopeless. And we think about high school should be a time where hopefully you're looking forward to the rest of life. That's not how nearly half of high school students feel. And the other number is 1 in 3, so about 33%. That is the number of young girls, of teenage girls in America who seriously consider taking their own life in 2021. That's an extraordinary number, and it should alarm all of us. What you see from all of this is that mental health struggles are common, and I suspect if the people who are listening today, if they pause for a moment and think about their own lives, they probably know a young person in their life who has been struggling with their mental health and well-being. But the good news is often mental health challenges are preventable and they are also treatable. So there's something we can do about this. And we've got to invest more in expanding access to treatment. We've got to invest in addressing the root causes that's driving this crisis. And we've also finally got to address the stigma and the shame that still surrounds mental health and prevents young people from asking for help when they need it.
Good. I think you've already answered half the questions I was going to ask you. All right, but let's start off with this country has had a mental health crisis, as other industrialized countries have for a long time. The pandemic has exacerbated that crisis. What are, above and beyond the pandemic, what are some of the causes that are resulting in these terrible statistics you've just related?
Yeah, so there are a number of things that are driving this pandemic. And I should also just say from the outset that one of the reasons I care so much about this is not just because of my job as Surgeon General, but it's because I'm a dad also. I've got 2 small kids. I'm thinking about their future as well, and I'm worried about them. I'm worried about the other kids in my life, and I know I'm not alone. So when we think about the drivers, I think there are a few things to keep in mind. One is that young people right now, many of them are experiencing a disturbing amount of trauma and particularly violence in their life. Gun violence in particular has become the #1 cause of death among young people in America. It's an extraordinary statistic and an incredibly disturbing one. And again, the trauma from gun violence isn't just to the individuals who are directly shot, who may lose their life or who may survive. it's to the people around them. You think about the children going through lockdown drills in school today who are wondering if this is the day something may happen to them, who read about these shootings in schools in the newspaper, who hear about it on the news all the time. This is striking fear into the minds and hearts of young people.
I was, as I mentioned to you earlier, recently visited a number of schools around the state of Vermont. And there was what is called a swatting incident. What swatting means is some lunatic calls in and says, there's a shooting going on in your school. And kids get locked down and they get rushed out of the school and the police come in and all that stuff. And some kid got up and he said, I still experience nightmares from that. All right. So kids, when we were younger, you go to school, it's a safe haven.
Yes.
It's more or less fun. And now kids and their parents worry. And so you got that on top of many other things, but you got that issue of gun violence and the fear of gun violence out there.
That's exactly right. And then there are other factors too. It turns out kids are also struggling with bullying. Like when I was growing up, you had to deal with bullying in school. Now kids are dealing with online and offline bullying, and the online bullying can continue at all hours of the day.
Let's spend a minute on that.
Sure.
That's a big issue.
Yeah.
When you and I were growing up, for better or worse, there were not these things. All right. These things have had a profound impact on our society, on young people in general. All right. Why don't you say a few words about what social media and the kind of time that young people spend on the phone, what is that doing to mental health?
Well, I think this is the right question because our phones and technology in general has really transformed our life. And some of that has been for the good. When I was growing up, it took several weeks for me to write a letter to my grandparents in India and for them to respond and have it sent back. Now I could FaceTime a relative halfway around the world. That's extraordinary. But I think what we have not accounted for are the downside impacts of not just our phones, but in particular social media. And when we look at young people, I think it's just about the conversations I have with young people about this, Senator. Around the country, when I do roundtables, even without bringing it up, young people raise their hands and they talk about social media. And they often tell me three things consistently. They say it often makes them feel worse about themselves using social media.
Why does it make them
because
feel
they constantly see other people posting things that they're doing, achievements that they've have,
so they're not as pretty or as good as somebody else?
Yeah, so what's happened, we've been comparing ourselves to people for millennia, but social media has dramatically accelerated the pace of comparison. And that culture of comparison it might be one thing for us as an adult to deal with that. But for young people, especially think about 12, 13, 14-year-olds, they're at a very sensitive time of development where their brain is developing, their relationships are developing, and they're particularly sensitive, it turns out, to social feedback. When what they're seeing on their feed is leading them to feel that they're not pretty enough, not smart enough, not good looking enough, not popular enough, this can weigh down on a child. And it's one thing, again, for them to hear it once during the school day. It's another thing for them to hear it and see it and feel it through hundreds and sometimes thousands of posts, in a given day that they may be scrolling through. So that environment really matters to our children. And so that's why so often people say, young people, makes them feel worse about themselves. But it doesn't stop there. Young people also say a second thing to me, which is that it makes them feel worse about their friendships. Now this is a bit counterintuitive. You might think, well, if you're connected to your friends, isn't that a great thing? But again, when they see other people doing lots of fun things without them, they often feel left out. It makes them sometimes question the quality of those friendships or whether they're really as close to that person as they thought. But finally, they tell me one more thing, which is they say they can't get off of it. And that is really important because you might think, well, if they have insight into the fact that it's not making them feel good, why don't they just stop using it? Well, a lot of these platforms have been designed by some of the most talented program developers in the world to maximize the amount of time that kids spend on them and that, frankly, adults spend on them too. That's what the business models are built around. Now, that might be
with
fine
the
from
ultimate goal of selling products.
Sure, and again, from a business perspective, that might be, a reasonable model, but from a public health perspective, that is not actually what we want because it's been having a bad effect on our kids. What I care about as a doctor is maximizing the quality of time that kids spend on technology, on their devices, ensuring that strengthens their relationships, strengthens their sense of self. And right now, the question I think parents legitimately ask is, where's the data that these platforms are safe for my kids? That they're not going to steal hours away from sleep, that they're not going to hurt their
Let's stay
sense
on the
of self.
sleep issue. I was told by teachers that it's not uncommon for kids to be texting at 2 o'clock in the morning. and
That's
not
right.
getting the sleep they need. Is that an issue?
It absolutely is, and we know that sleep critical for young people in particular. It's important for all of us, but it's important for young people's growth, but it also is important for their mental health. When kids do not get enough sleep, it increases the risk for challenges with their mental health down the line. And so we are finding that many kids are taking their phones into the bedroom, right? And they're using it and staying up well past their bedtime, often to midnight or later. And it's not just that they're stealing hours away from sleep, it's what they're engaged in those hours right before they fall asleep. Sometimes it can be contentious conversations, sometimes they can be exposed to harmful content during that time, sometimes they could be, again, scrolling through many posts, feeling worse and worse about themselves. So, I care about the number of hours they're spending, on social media, particularly when it's stealing hours away from sleep, but I also worry about it stealing hours away from in-person interaction. Okay. And that's a real price that kids are paying.
Is there, if you and I are chatting on Facebook or texting, we're relating to each other.
Yeah.
You and I are sitting here looking face to face.
Yeah.
From a medical point of view, from a physiological point of view, is there a difference between human contact and contact through social media?
There's a difference. There really is no substitute for in-person interaction. Now, that doesn't mean that there's no place for online interaction. And if ideally what you have is a good balance of both. Like I'll give you an example. Like today I saw my wife and my children in the morning when I got up and when I dropped my kids off from school. It was wonderful to have that in-person time. On the way back, I called my mother, who lives in Florida, and I spoke to her on the phone. Now, we weren't face-to-face, but it felt really good to be able to hear her voice. So being able to interact with people through a variety of modalities is very positive. The danger becomes when we start to increasingly substitute the online interactions for what used to be offline, in-person interactions. And what we're finding right now is that the amount of time that kids, young people spend in person has decreased by 70% in the last 2 decades. 70%.
That's rather extraordinary, isn't it?
It is extraordinary. And think about it, for thousands of years, we evolved as human beings to be in person, to interpret body language, the tone of your voice, your facial expressions. There's so much more than just the words you say that help build a relationship and a connection. And if you're just texting, for example, or if you're messaging on a platform, you don't always have that context. You're not always building this strength of relationship you might otherwise have.
Let me ask you this. The world, when you talk about the enormous amount of time people are now communicating via social media as opposed to human interaction, the other aspect of that is the constant bombardment of information that people receive. I was thinking back in preparation for this discussion, 70, 80 years ago in Vermont, most people lived on farms, they worked hard physically, communicated with their family, maybe some friends and so forth, and how radically different in 70, 80 years the world has become. So if you forget the phone, just turn on television, you're bombarded hour after hour. I love football, but I can't watch football games on TV because I can't stand being bombarded by dozens and dozens of commercials in and out. What does it do to the human mind and human health to have so much information coming in?
Well, I think you're exactly right. When I was growing up and I wanted to turn off the flow of information into my life, I just turned off the TV. Now it's not that easy. It's coming at us, like you said, 24/7, and especially through the devices in our pockets. I think it has a few important effects. On the one hand, yes, it's always convenient to be able to access information when you need it. It can be helpful from a work perspective as well. But when it's constant, when we don't have boundaries around it, what happens is that it can actually become a source of increasing stress in our life, especially if the content that we're being bombarded with is predominantly negative news or information that stokes anxiety or fear, as we're increasingly seeing. But the other piece to keep in mind here as well is that we all need moments of respite, breaks, where our mind is not engaged with 50,000 things at the same time. We also need to be able to focus our attention. And I talk to so many people today who feel like they've lost their ability to focus, who used to be able to sit down and read books and now can't do that anymore.
Let me just interrupt you.
Yeah.
Teachers tell me there was a time not so many years ago they were teaching Spanish. You teach a 45-minute period of Spanish. They can't do that anymore. They have to take breaks at the end of 15 to 20 minutes that the kids walk around. That attention spans has significantly declined. Is that something you've observed or heard about?
It's certainly something I've observed, and heard a lot about, from the people I've talked to, both not just kids, but also parents and adults in the community. And this is an area of active research as well. But I do think that this fracturing of our attention is really critical. We know that when you are working on a task, for example, and you get distracted, let's say by an alert that pops up on your phone, it takes you a while to rebuild your focus. According to some studies, it can take up to 23 minutes for you to refocus in a deep manner, on something you're doing. That's a lot of time. And if you're getting pinged all the time, then you may never be able to truly focus deeply, right? But I also want to point out that these moments of respite, of pause and peace that we used to have, in our lives, when we were, for example, waiting for the bus, or when we were sitting in a restaurant waiting for a friend to show up, those were not wasted moments, because our brain is processing in the background, and we are also giving our system a rest to be able to process and to de-stress a bit. And what we've done is we've filled in all the white space in our life with our phones, right? So now when we're waiting at a restaurant for a friend, we immediately pull out our devices, and we look at our messages. We try to be, quote unquote, efficient. But what we aren't realizing is how much we may be losing in terms of efficiency and also quality of life when our attention is fractured and we're under constant stress from what we're hearing.
This is an incredibly radical departure from human life of not so many years ago, isn't it? I mean, we're kind of living as guinea pigs in a very weird experiment, which may not be working out all that well.
Yeah, and it's one of those things, like when you're in the middle of it, it's hard to see how rapid the change is.
Right.
But even just in the last few decades, so much has changed. People are moving around a lot more. They change jobs more. What kind of jobs are important has dramatically shifted as the global economy has changed. How we communicate and relate to each other.
Gender identity and all that stuff?
Yeah, the language we use, how we talk about issues has dramatically changed. I also worry that the nature of our dialogue has changed, and not always in ways that have been healthy. But I think, because during times of change, often we process that change by being able to talk to each other openly about what we're going through, what's happening. But I do worry that right now dialogue has become poisoned in some ways, and people find it harder to talk to folks who may have different points of view. Sometimes they preemptively pull back, and say, hey, I don't want to talk about this. I don't know if if it's going to be sensitive, or if people may disagree with me. To me, that's tough, especially in an environment where people are going through a lot of change and experiencing a lot of stress, because as human beings, we need to be able to connect and dialogue with one another. That's how we make sense of chaos and change.
All right, so we are living in, the world always changes, but it is changing a lot more rapidly now than it has ever changed before. We don't quite know the impact of our dependency on phones and the constant bombardment of information that we receive. Say a word about, you mentioned before that our kids are up against some of the best minds in the world who make a whole lot of money by programming, doing program which has the goal of addicting people to their machines so they can sell them products and make money. All right, talk about that a little bit. What's the goal of these guys? Why are they doing what they're doing?
Yeah, well, while I haven't been in their shoes, and I'll be, be mindful of that, I do think that for many of the companies, their business model has traditionally been built on maximizing attention and time spent. And to me, that's a different goal from maximizing the quality of time that people are spending. And what I also worry about is we know that many people, young people in particular, can be exposed to harmful content, online, and especially violent content, but other content that can impact their mental health and well-being. And so if you're building a platform where you want people to spend time, in my mind, one of the things that's really critical to that is to be able to understand not just a positive impact on them, but also concerning and harmful impacts on their mental health and well-being. And to do that in a way that's really robust, you need to be able to share the data that you have with independent researchers so that they can make their assessment.
Well, you're a nice guy, and you're assuming that they are concerned about the people, the well-being of the people who are using their platforms.
Well, so here's the thing. I do think
I'm not so sure that that's the case.
Yeah, look, to give folks there the benefit of the doubt, I suspect that most people, when they began and built these platforms, did not build them with the intent of trying to create harm.
Right, I'm sure that's the case.
But I do think that all of us have a responsibility to make sure that we are not inadvertently creating harm. And if we start to see evidence of harm, we've got to address it and address it quickly. I just think about my own job, as a doctor. If I ran a hospital, right, where I was treating people with pneumonia and with other infections and with heart attacks, but I also allowed a really high rate of, let's say, complications in the hospital, like line infections or in-hospital blood clots to develop, or people were slipping on floors and falling and hurting themselves because I wasn't taking care of the floors. And if that was affecting a large number of people, I'd probably get shut down, right? Because as much good as I may be doing, if I'm not also looking out for the safety of the people that I'm serving, I'm not doing my job.
So you're suggesting we shut them down tomorrow, right?
Well, what I'm suggesting is that we've got to ideally do several things. One is put safety standards in place, like we do for many other consumer products.
Talk about that for a minute. What are you talking about when you say safety standards?
Well, when I think about safety standards, I think about the kind of provisions that would protect young people from exposure to harmful content, whether that's pornography, whether that's violence, whether that's other content that could be harmful to their mental health and well-being. But I'm also talking about protecting young people from the kind of features that may increase the amount of usage that they have at the expense of their mental health. So the features that are designed to keep people on them all the time, that allow young people to stay up late at night using these, like well into the wee hours of the morning and robbing them of their sleep, these are features.
Describe some of those features, if you might. What are the
Sure.
features you're talking about?
Well, I think most people will probably recognize these from their own use of social media, but we think about, for example, the ability to scroll infinitely, on your feed. And that means you don't just see 10 or 20 posts, but you can keep scrolling forever, right, and going through feeds, which can become hours, on social media. I'm also thinking about the fact that if you can be on the platforms 24/7 and you're a young person who's still developing and not able to create boundaries yourself, then you are going to rob yourself potentially of hours of sleep to do that. And so these are just some examples, of the kind of features. Like buttons also, are features which, try to draw kids in to maximize the amount of attention that they're getting and approval that they're getting from other people. And that might not seem like a harmful thing, but, if you're an adult using this, that sometimes you can start chasing likes, and chasing the number of people who repost because you're looking for validation, and that can become its own harmful cycle. So these are the kind of features which can have negative impacts on kids, and to have safety standards would mean to put the kind of standards in place to protect children from exposure not just to harmful content, but to features which may lead to unhealthy use.
Is this a function of government?
Well, I don't think it's a need that has been met so far, and so I think it is important for policymakers to step in here. Look, these platforms have been around for more than a decade, and we are still seeing, in my view, insufficient action taken when it comes to putting these kind of safety standards in place, and also then to being open and transparent with data so that independent researchers can assess the impact of these platforms on the mental health of young people, and in particular can understand which kids are most at risk. Until we have that, in my view, and frankly also until we actually have real enforcement around age, because even though technically now the age 13 is when children can use many of these platforms, we find that 40% of kids aged 7 through 12 are using social media, according to a University of Michigan study. 40%. That's an extraordinary number. That tells us that enforcement is not really happening when it comes to age 13. And frankly,
well, who is supposed to be doing the enforcement today? The industry?
Well, so that's the problem. I think you're right. It's left up to industry, and I don't think it's happening. So I think that's a problem. But I also think, look, we've got to look at the world we're living in now and ask the question: is 13 really the appropriate age for children to be using the platforms as they are currently designed? I think if we actually had...
What is the answer in your judgment?
In my judgment, the answer is no. It's not. If we had age-appropriate design, which would mean we designed these for kids of a specific age and actually rigorously assessed their safety and demonstrated that they were okay for kids, that might be a different question. But as they're designed today, I worry, based on the data that I've seen and the conversations I've had with families and with young people in particular, that 13 is too young.
All right, we've talked appropriately enough about social media. We could talk a whole lot about that, because it's just stunning to me how transformative social media has been in the last just a few decades. And we are only beginning to grapple with the impact that has had on the mental health of all people, especially young people whose brains are developing. So we're looking at a generation of young people who have gone through the pandemic. Let's say a word about that. What does it mean for a kid whose school life for the first time in memory has been disrupted? They took a year and a half off of school. Their learning fell behind, academic capabilities suffered, their socialization suffered. They may have seen family die or get sick. I'll never forget going to a school in northern Vermont in the middle of the pandemic. They were holding classes, we're outside literally. And the young lady said, I love my grandmother so much, and she's in a nursing home and I can't visit her. They don't allow her into the nursing home. What is all of that? Or you're worried that your grandfather may die or your mother may get sick. What is it? You see, you got the pandemic, you got social media, you combine the two. That's a hell of a lot for a generation, isn't it?
It's a lot. I mean, and just to talk about the pandemic for a moment there, we know that one of the greatest sources of trauma in a child's life is losing a caregiver, a parent, for example. And we had more than 160,000 children in America who lost a caregiver due to COVID. But it's also the fear of losing a loved one. And we know many more kids than that actually had loved ones, parents in particular, who got sick.
I know of one instance of somebody close to me whose kid scared to death that she was going to die. And it became a real cycle. You had to call her up all the time to make sure she was well. But I expect that is not unusual. Kids see people dying or hear about death statistics during the heart of the pandemic. The worry must be enormous, right?
It is enormous. And we also know, like, for kids, like, one of the most important things they need in their life to be healthy and well, and not just, again, from a physical mental health standpoint, but this has implications for their, academic achievement, economic productivity on the line. The factor that's really critical to all of that is secure attachments. That means healthy relationships. And you keep in mind, not only were young people worried about losing their loved ones, but at a time where they were also scared and stressed about everything that was happening in the world, they weren't able to see one another, right? And so at a time where they needed people more than ever, they were separated, right? And I understand, the reasons for why it may have happened. In the early days of the pandemic, people didn't know what was going on, and they were erring on the side of caution, so I certainly understand that. But I think we have to now recognize the real consequences that's had for kids. And so when I talk to kids around the country, I remember talking to a fifth grader in Washington, D.C., who told me that he felt that he had to grow up really fast during the pandemic because he saw how stressed his parents were, worried about their jobs, worried about the loved one's health. And he felt like he couldn't go to them with what he was worried about because he didn't want to make their stress worse.
That's a kid who was in fifth grade?
Fifth grade.
I talked to somebody who was in high school, said the same thing. He said, look, my parents are over, they're worried about money. They don't have enough money. And the pandemic did its thing on economics in this country. And I don't want to lay my burden, my problems on my parents. They have enough to worry about.
That's right. And speaking of high school students, the other day I was talking to a high school student in Chicago who told me that even though he's been back in school for a while, he feels like he and his classmates are still learning how to socialize again and how to connect with one another. Now, this might be something that as adults we may take for granted, that if we're not in work for a year or so and then we come back, that the skills come right back, but it's different for young people.
I am told by teachers that remembering what it used to be is taking a bit of time, that there's more violence in schools. Kids are fighting more than used to be the case.
That's what I hear too when I travel to schools around the country. So this adjustment is going to take some time for our kids. But one thing I just want to say though to parents, out there as well, and for all parents to know, is that when you hear all this can feel overwhelming. It's like, oh my gosh, there's so much happening to my child. It's taken so long, for these challenges to resolve. And in addition to everything we've talked about, there's of course the issues of loneliness and isolation that kids are facing that are fueling this, the worries they have about climate change and other existential threats, and they ask, is the future really going to be better than the past? You put all this together, it's a lot.
And the economics of everything being equal. Sadly, their generation may have a lower standard of living than their parents for economic reasons.
That's right, and especially when you add to that the experience of racism and discrimination that many people have gone through. When you think about LGBTQ youth and the bullying and the racism discrimination they've experienced, it creates a lot of reasons why young people are suffering. But as a parent, I think what we also have to realize is that our mental health impacts the mental health of our kids, and this has been a really tough time for parents. They were trying to hold so much together during the pandemic. So I just want to ask, parents out there also just give themselves a break for a moment and recognize that they've got a lot on their shoulders, and you don't have to actually be able to solve the root causes of all these problems in your child's life like right away. The most important thing that you can do for your child during a time of turbulence is to make sure that they know that you love them and that you're there for them and that they can talk to you if they have problems, right? The first time you have that conversation with your child, they may say nothing. You know, kids don't always volunteer everything that's on their mind. But for them just to know that it's okay for them to talk to you about their mental health, that it's not something that they should be ashamed of, for them to know that, hey, there are people we can go to for help. And for every parent should know, for example, that 988 is a crisis line that has now been set up, that anyone can call anywhere in the country to get access to a trained counselor. It's just like 911, but for mental health. So just remember as a parent, if you can make sure your kids know that you love them, that you're there for them, and that they can talk to you if they have problems, that goes a long way to helping a child feel that they're not alone.
And I think what parents and kids have got to appreciate is they're not the only people. Your family is not the only family dealing with these problems. And as a nation, we're going to have to grapple with it. All right, let me do this. We've talked at length, about the problems. Let's talk about solutions. All right, for a start, the government has established a 988 number. All right, so if I call 988, what happens? Who should call 988, and what kind of response do I get?
So anybody who's experiencing a mental health crisis, or if you have somebody immediately around you who is, you can call or text 988. And just like we call 911 when we have an emergency, when we call 988, you actually will get connected to a trained counselor who can help you through that difficult moment.
There are enough counselors at the end of the line to respond to the calls?
Yeah, so what's been happening over the last year plus is that there has been more and more money that the administration, working with Congress, has been putting in to building out the local networks, right? So that we can shorten wait times. But now many people have been able to access counselors on 988. We want more people to know about it. Remember, you can not just call, but you can text as well. A lot of young people and people in general are more comfortable with texting, so know that that's an option too.
All right, but let's be clear, and that's great, and that's important, and I guess that's above and beyond suicide prevention. And there are numbers out there, I assume, if somebody is suicidal?
So similar, you can use 988 for that as well. Okay. If you or somebody you're worried that they're suicidal, you can call 988 as well.
All right, it is no great secret that our healthcare system is reasonably dysfunctional, in my view. I don't speak for you.
Yeah.
And we have so many people who are uninsured, underinsured. The costs are very high. Look, we get calls in my office every week. My husband is in midst of a crisis. We can't find the help we need. We can't afford the help we need. This is going on all over the country. So I think it goes without saying, well, I want you to talk about this a little bit, that we really need to grow our mental health workforce very significantly, from psychiatrists to counselors to everything in between. True?
Yes, and so we talked about these three buckets earlier that we have to address: stigma, prevention, treatment. So let's dig into that treatment bucket, as you're mentioning. It takes too long for too many people to get mental health care in this country right now. They have to drive too far, they have to wait too long.
Maybe they can't afford it.
Yeah, and many may not have insurance, or even if they have insurance, they may not actually. Copays may be high, and there may not be providers in their network, their insurance network, to provide care. So, in the last 2 years, there's been a lot of efforts, from the administration and Congress to try to close some of these gaps, right? We do need to train more mental health providers, but we've also got to broaden our scope of what we think, is in the bucket of mental health providers. It's not only psychiatrists and psychologists, but we have to think about how to more effectively use peer counselors and peer support, which...
All right, I want to get to that in a second. Because, as I have mentioned to you several times, we can't simply treat our way out of this crisis. Half the country is going to be counseling the other half, and that's not going to happen. We need to better understand the causes and how, as a society, we can short-term and long-term address it. We have to create a healthier society.
That's right.
All right, but I wanted to say on the workforce, we do need to train. How do we do that, by the way? Because I'm chairman of the committee that deals with it. Love to have your ideas. We need more mental health professionals up and down the line. How do we grow that number?
Yeah, so one of the things we have to do there is we need more training slots. We need to fund more training slots in residency programs, for example, so that we have more psychiatry training opportunities available.
Graduate medical education.
Yes, graduate medical education. We've also got to inspire more young people to go into
that means you.
mental health professionals.
That means you out
exactly
there,
right.
All right. we have a crisis in healthcare and mental health in particular. We need more people to become mental health professionals, correct?
That's exactly right. And this is work where you can make such a profound difference in the life of another human being and of a family, at a point in crisis. So it's incredibly meaningful and urgent work.
All right, so if I don't want to become a psychiatrist,
Yeah.
what are the job opportunities out there in mental health available today?
Oh, well, you can become you can become a counselor. You can be in a school. You can be a licensed clinical social worker. You can become, a psychologist. There are a number of roles that you can take in your community to actually address mental health.
Are colleges and universities doing an adequate job in training the number of people that we need?
Well, I do think we need. Well, they're doing an admirable job, but we need more people in the pipeline. Who are interested. We need undergraduate colleges to cultivate more interest, in mental health, so that more people will actually go into it as clinical practitioners. But the other thing we've got to do if we want more people to go into these professions is we've got to make the work more manageable, right? We've got to support it better, and that means that we have to not only make sure that we're adequately, compensating folks, et cetera, but we've got to make sure that that we're reducing the amount of red tape and administrative burden in their job so they can focus more time with patients.
Because I think what you're suggesting here, I'm putting words into your mouth, is there's a lot of burnout going on out there.
Absolutely, yeah. And in fact, just exactly a year ago, I issued a Surgeon General's advisory on health worker burnout because this has become a crisis in our country. And we have more than 50% of nurses who say they want to leave their clinical work, 25% of doctors who are saying the same. I mean, that will present a crisis not just for emergency care, but for primary care. So we've got to improve the quality of the work as well. And look, here's the bottom line. People don't go into these professions because they want to fill out prior authorization forms.
That's right.
Because they want to fill out the same questions again and again and again on the electronic
I don't want to get this guy
Yeah.
in trouble, but this takes us to another issue. I mean, and why we are the only major country on earth not to guarantee health care to all, including mental health. Why doctors have to argue with insurance companies as to whether they can provide this type of therapy or not. That leads me, I don't want to talk for him, to Medicare for all, but that's another issue. But I do want to...
But can I just say on that point, Senator, because this is a really important point. You raised the issue that like, doctors and patients shouldn't have to be fighting with insurance companies to get the care they need. I mean, that to me is just such a fundamental problem right now. Like I talk to doctors and to nurses and to patients around the country who saying in their moment of health crisis, they're on the phone trying to battle with an insurance company, often talking to somebody who may not have the medical training and background that's needed to make this decision, but they're blocking their ability to get care or to get the medications they need. That is just wrong, and that should not happen.
It is driving, it is just breaking the hearts of doctors and making it, making them question why they went into the profession in the first place. All right, so we're going to work on we need to radically increase healthcare workforce. And by the way, it's not just in mental health. We don't have enough doctors in general. We don't have, talk about nursing.
Yes.
We have a major crisis in nursing. We don't have enough dentists. We don't have, you name it.
Yeah.
And a question arises why in the richest country on earth we don't have enough healthcare professionals, but that is another issue. All right, I want to get to, again, we've talked a lot about, appropriately so, the problems. Are there good things happening in this country, in communities, to address some of the issues we're talking about?
So this is one of the reasons I actually feel quite optimistic and hopeful when I think about the mental health challenges we face, because as big as the problems are, I actually do think there's a lot we can do, and a lot of it's starting to happen already. So, for example, well, just overall, a big picture, we should just, when I think about the last nearly 30 years that I've been working in public health, I have never seen as much public interest, as much investment from the federal government, and as much bipartisan unity around investing in and addressing the mental health crisis. That's really important, and we've got to just use that momentum to get us further. And we've also, as a result of that, by the way, seen these unprecedented investments in expanding access to treatment and addressing prevention. So this is really good. But here's some examples of specific things I've seen and heard about that I think are really promising. In Chicago, speaking of peer education and peer support programs, I've had the chance to visit the Becoming a Man program and have also worked with some of the folks who are developing and implementing the Working on Womanhood program. These are programs for high school boys and girls. And what they do is they use the power of peer relationships and connections by bringing young people together in groups once a week with a counselor / moderator, facilitator, where they can actually talk about what they're going through. They can build relationships with one another. And when the University of Chicago studied this program, by the way, the Becoming a Man program, they found that the schools that had this program compared to schools that did not had a 50% reduction in the rate of violent arrests compared to the other schools. And there were other important benefits in terms of the mental health of the kids. So these are programs that, again, they don't take having a psychiatrist in the school. These are programs that are much more manageable. But the other program...
All right, let me ask you this.
Go ahead.
I think this is enormously important. When I go to high schools, and I do that fairly often in Vermont, and I ask kids whether they are talking to each other and sharing their problems, and there is a reluctance. They're not doing that. So what you're suggesting, I think, is to create an environment where kids can say, this is what I'm going through. And so, wow, gee, that's what I'm going through, and talk about it. Is that what you're talking about?
Yeah, that's right. And I'll actually just tell you that I visited the Becoming a Man program once, and I'll tell you about an interaction I saw that was instructive. I remember one young man, he wasn't saying a whole lot in the group when everyone was going around to talk. And so the other boys knew him, and you know, because they'd been together for a while. So they said, hey, what's going on? Why are you so quiet? And it turned, and they said, we know something happened. You know, that's why you're being quiet. Like, did you get mad at somebody? Did you get into a fight with somebody? What happened? They were eventually able to get him to open up and talk about the fact that he had gotten into a fight with someone. But they also recognized that he was at risk of doing something bad afterward to retaliate. So they actually, in that moment, kind of talked him down. And they did it in a way that was actually very, very brotherly. And there was a lot of tough love there. But they said, hey, look, we know you run into problems in the past. You know that you haven't reacted the right way. You know, when you've had fights with people before, what are you going to do now? How are you going to handle this? And they kind of pushed him. And because he knew that, you know, they were coming from a place of love, because there was trust there, he was able to take those questions and respond to them. And at the end, he had opened up. He was talking more. You could just see from his body language that he was in a much better place. That's an example of what we can do for each other. And it's one of the reasons why I think as we think about the workforce, as we think about programs around the country, we have to make sure that not only are young people at the table helping to shape solutions, but that they're part of the solutions themselves, because they have a tremendous amount of power when it comes to helping each other heal.
No, I think that sounds absolutely right to me. Anything else come to your mind that we should be looking at?
So technology is another place when it comes to extending access to care that I think we've got to continue to press on. You know, one of the silver linings of the pandemic is it accelerated telemedicine use, right? So people are able to get distance care, virtual care. That is incredibly important when it comes to mental health care. You think about rural parts of our country, which may not have a lot of in-person mental health providers, but we can provide virtual care so people in other parts of the country can deliver care there. That's important.
You know, let me interrupt you to say I was some years ago chairman of the Veterans the Veterans Committee, and the VA has been actually for a long time a leader in telehealth in general, and I was really asking, does it really work? I mean, do I really want to talk to a counselor or a therapist on a screen? And you know what people said? Yeah, it does actually. Is that your experience? That it's
absolutely, and you know, it's different. Like you can't obviously necessarily get an operation, you know, virtually, but being able to talk to somebody virtually, it can be remarkably effective. And especially, you think about younger generations are more comfortable with online conversations.
Well, and in addition to that, I was thinking about older people, veterans in that case. They're at home.
Yeah,
they didn't have to get in their car, park someplace, walk into a waiting room, and all that stuff.
Yeah, and those logistical barriers make a huge difference. I know from my own time, you know, taking care of patients in the hospital, that so many times we would, you know, get follow-up appointments for patients, but then we would worry, are they going to be able to make it to their appointment? And if they have so many appointments, can they keep them all straight? But again, doing this virtually can go a long way to complementing care. And the good news is, like, you think about the pediatric mental health access program, you know, which has been implemented in states like Massachusetts. These are programs which actually have used technology to bring a mental health professional into the primary care office. Because keep in mind, a lot of mental health care, as you know, falls on primary care providers to do, but they often may not have the time or expertise. But you use technology, you bring them in, and they've been able to expand access now to mental health care to so many children who otherwise would have had to wait months potentially, you know, to get the care they need. So we've got to press on making sure this technology is available across state lines, and that we're reimbursing adequately for it so that it's actually provided.
All right, let me do this now.
Yeah.
On our social media, we requested questions, and apparently many of them came in. I got a few right here. I think we went over this, but let me ask it again. This comes from Laura in Vermont, actually. Is there a lack of capacity to help young people? My son has called 4 or 5 therapists, and none had capacity to even return his call or to recommend someone else. There should be a way that patients can find therapists that suit them more easily than cold calling. That's a good question, I think.
Yeah, it's really important. And the truth is, yes, there has been a shortage for many years when it comes to mental health providers. Now we're finally, in the last 2 years, getting more investment in training more mental health providers and investing in the kind of technology to bring care to where people are and to bring counselors into schools. And this is starting to help. But we've got to do everything we can to accelerate that. And keep in mind the insurance piece here is important too, because many people will look at the mental health providers in their insurance network and will find that there aren't that many, right? So part of what we have to do is to ensure that insurance companies are not only adequately reimbursing for mental health services, but that they have adequate networks as well.
Right.
And
that's isn't one of the, when we talk about insurance companies, and I'm not a great fan of insurance companies, sometimes they limit the number of visits that a patient can experience, right?
That's true, and that is really problematic because you can't across the board say that, okay, you get 3 visits or 5 visits and then you're done. Some people may only need a few visits. Some people may need longitudinal visits for a long time, but we have to keep in mind what we're preventing there, which is we're preventing human suffering, we're preventing a worsening mental health condition that could end up in hospitalization and be worse for a family, and also it turns out more expensive for the healthcare system. So it pays to make sure that people have access to as much care as they need. These barriers, which prevent people from getting that make decisions for them and in place of their doctors, to me, these are counterproductive.
Okay, we have a question from Devin. He asks, what are some of the best non-medication interventions for mental health when it comes to teens?
I'll tell you, one of the most powerful things to help young people, teens in particular, with their mental health is actually healthy relationships. It's social connection. When you're able to build healthy, trusted relationships with other people, especially with peers, that goes a long way toward helping you cope. Now, the challenge is many people don't have these relationships. So if you're a parent out there who's got a teen at home, there are a few things that you can keep in mind. One is to do everything you can to make sure that your child actually has time for in-person interaction with other kids and with family members as well.
Some of that might be after-school activity, whether it's playing ball or being in theater or...
Absolutely.
Whatever.
It could be that. And it could also, the other thing you can do as a parent is get your kids engaged in volunteer activities, because it turns out, interestingly, that service is one of the most powerful antidotes to loneliness and disconnection. It helps us build a bond with somebody else, but it also reminds us that we have something of value to bring to the world. And the reason this is so critical is when our kids struggle with loneliness for a long period of time, it chips away at their sense of self-esteem. It makes them feel that, hey, maybe I'm lonely or alone because I'm not likable or I'm not lovable, and that can become a downward spiral. And service, getting your kids involved in service activities, can help there as well.
All right, I should have asked you this before. You used the word loneliness, you've written about that, you wrote a book on it. So if we're surrounded by all kinds of people and we're on the phone every minute, we're bombarded, how in God's name could we be lonely?
It's such a good question, and it has to do with the fact that loneliness is actually about how we feel. It's not about how many people are around us. So if we're surrounded by people, but we actually don't feel like they understand us, or we don't feel like we can actually be ourselves around them, then we actually might get lonely in a hurry. And I saw this like up front, when I went to, I remember in 2015, I visited a college campus, one of the largest universities in our country, and I was talking to a very large group of students. And I came to understand that many of them were experiencing loneliness. And it was that moment that I thought, oh my gosh, these kids are on campus surrounded by thousands of other students, but they're feeling lonely because they don't feel like they can be themselves, they don't feel like other people understand them, and they don't have environments where they can actually build healthy relationships with one another. So that's why, you may have workplaces where people feel lonely, even though there are a lot of folks.
So you could be surrounded
schools.
by a million people and be very lonely.
Yes, and keep in mind, this is true in families too. We may care about our family members, but if we have a circumstance where they don't feel like they can be open with us or talk to us about what's going on in their life, sometimes they can be lonely really quickly. One other thing just to keep in mind is that there are different types of relationships that we need in our life, and 3 categories in particular I think about. One are intimate connections. These are the connections we have with our spouses or best friends, people with whom we can share almost anything. The second are our relational connections. These are our friendships, people we have over for a barbecue or for birthday parties or go out to dinner or a movie with. And then there are collective connections. These are the connections with people in our faith organizations, in our churches or synagogues or mosques. These are our connections with people in our workplace or in the service organization that we volunteer in. We need these three different types of connection in our life to some degree. And if you understand this, then you understand why somebody may be in a perfectly healthy marriage, but feel lonely if they don't have friends, right? And that's important because if you're that person's spouse, you might think, hey, if they're lonely, this must be about me, or must be about something wrong with our relationship. It may not be about your relationship at all. It may be about their friendships and about their sense of community.
Okay. Travis from Arkansas. In this healthcare system, how do we make mental health care accessible and affordable for everybody? Good question.
Well, that's the important question, and it starts with making sure that we've got insurance coverage for everyone in the country. And we've made strides to expand subsidies in the last couple of years, get more people insured, but we've got more work to do there.
And by the way, this cliff that Medicaid has undergone,
yes,
is going to be a very negative.
It will, yeah. This is going to be challenging for states where people will be taken off the Medicaid rolls. But so we've got to insure everyone. We've got to also make sure that the insurance networks, the provider networks, have an adequate number of mental health providers. And we've got to train more mental health providers so that people don't have to wait long periods of time. And finally, use technology to bring care to where people are. The days of having to wait 3 months and drive 30 miles to see a mental health provider, we've got to get rid of that time. We've got to increasingly bring care to where people are. Think about a time when kids can actually start to get mental health care and talk to counselors on their phone or on their device from school or from home. Think about where people can get care in their workplaces or in their homes, where nurses or doctors or physical therapists working long hours in the hospital can actually go to a separate room within their hospital and get virtual care. We got to make it easier for people to get care where they are.
You're describing a rational healthcare system, aren't you? Which is far from where we are today.
Yeah.
All right, we've covered a lot of ground. I'm sure there's anything on your mind that we haven't touched upon that you'd like to.
Well, I just want to say that as heavy as these issues are and as challenging as they are, I do believe that we have a window like I've never seen before to make progress on mental health, to ensure that every child in America not only has the care they need when they need it, but also that we get at these root causes of what's driving so much pain in our children's lives. And I can't think of something that's more important as a father than making sure that we are caring for the mental health and well-being of the next generation. So we've got to keep talking about this as a community. We've got to come together as parents, as community members, as families, to support one another, recognizing how powerful social connection is in strengthening and supporting our mental health. And from a policy level, we've got to ensure that we invest and continue to invest heavily in prevention and in treatment, because for too many years we have failed to invest, I think, as a country in the kind of mental health care that people deserve. We're paying the price in part for that, but this is our time, our opportunity to turn that around.
Well, as chairman of one of the committees that's dealing with this issue, we're certainly going to do our best. I just want to thank you very much. You're the Surgeon General, you're the major public health official in the United States, and I appreciate your getting out there and talking not only about mental health, but so many other important issues. So thank you very much for what you're doing. Keep up the great work, and thank you all very much for joining us.
Thanks so much, Senator. I'm glad we're working on this together, and thanks everyone for joining. Appreciate you.